children have not just the three-dimensional problems that we have in adults, but they have a fourth dimension. And that fourth dimension is growth. We have to provide a solution that will be able to grow with the patient.
We're always asking ourselves one simple question, which is what is best for the patient and the family. At other hospitals, patients might see a medical specialist, and then subsequently they will see a surgical specialist, and they might see a psychologist, and they'll see a social worker, and each one of these is a separate trip. So what's different here at the Children's Hospital at Montefiore, from the point of view of a patient being looked after by a team that is truly integrated, that's a unique experience for patients.
No other institution in the country has a clinic that brings together a geneticist, a cardiologist, a social worker to meet with families and discuss these issues. Last week, we had a family who came. We had identified a mutation in the long QT syndrome type 3 gene, and sitting in a room with that family was myself, a pediatric cardiologist, and an adult cardiologist, and we spent an hour talking with this family about the implications of the finding.
Well, I think the hybrid approach is a good example of how we're using team care here at Montefiore to deliver the state-of-the-art care to children and infants with congenital heart disease. Traditionally, surgery has been performed in babies with the most complicated heart defects very soon after they're born. And as you can imagine, that is difficult to do because the babies are quite small and often quite ill.
Last week, a child came through the hospital, born at one of our referring institutions. A diagnosis of interrupted aortic arch with ventricular septal defect was made. It was a very complex form of it, and the patient was transferred here, and in the early morning, Dr. Weinstein, who's our cardiac surgeon, me, Dr. Sue, our chief, Dr. Lamore, and Dr. Leo Lopez, who's the director of the Echo Lab, sat around the table, looked at these images, and we all thought long and hard about what the best option for this particular child was. This is the type of thing that would not happen at my old institution. It would be rare to have all of the main players in the same room within 3 hours of the patient touching down in the hospital. And we all decided as a team that the best option for this child was to undergo a hybrid procedure. Within 4 hours of that meeting, we were in the cardiac cath lab doing surgery and a cath together.
With a hybrid procedure, we can do procedures in a room designed so that surgeons and cardiologists can work together. It's only being done at a handful of institutions in this country.
Dr. Weinstein opened the patient's chest. He put pulmonary artery bands on the right and left pulmonary arteries, and then he placed my vascular sheath in the main pulmonary artery to allow me the opportunity to stent the patent ductus arteriosus. And in so doing, we basically stabilized the circulation, and the patient no longer needed to have bypass surgery. So there was no circulatory arrest, there was no cardiopulmonary bypass, and the patient was extubated from the ventilator within 24 hours, and now 5 or 6 days later is almost ready to go home.
The hospital's made a great commitment also to say that we're going to take cardiology care we deliver to children to the next level, which is going to allow us to say to children who are cared for by us, we can take care of you whatever happens to your heart.
When I came to Montefiore, I had an eye-opening experience where essentially it was a multidisciplinary approach, and now we do surgeries that in some cases will entail up to 4 or 5 different surgical teams.
Our operating rooms are open to each other, and so the cross-pollination between specialties has been greater here than any of the other institutions that I've worked in. And I think that it is that cross-pollination and the comfort with which we work with each other that allows us to raise the bar and to provide for each patient the absolute best care.
When I came here to the Children's Hospital, I brought my lab with me. We've brought everything that would be available at a cancer center to a much more children's friendly environment. So what are the things that make a cancer center unique? It's the ability to deliver chemotherapy in the most effective means. It's the ability to have a laboratory that's translating the findings of the laboratory into the clinic, and a supportive environment that's all about willingness to do research.
Dr. Ozawa's recruitments have been absolutely amazing. I know that one of the considerations for some of the faculty members that come here is the quality of the residency training program. And the interdisciplinary patient care really enriches the training of my interns and residents because it exposes them to the expertise of faculty that's really world-renowned.
The kind of people that are leading programs in the Children's Hospital would not be here without a School of Medicine of the caliber of the Einstein School. The only way you develop new knowledge is by making connections between the science and the care. The school is superb. Montefiore's medicine, it's like a mirror image. It's innovative, it pushes the bounds in terms of new knowledge. It is clinically superb. The outcomes here are outstanding. So when you marry those two, you create an environment where the whole is greater than the sum of the parts. As we build programs in the Children's Hospital and connect them with the Albert Einstein College of Medicine, we are relentless in terms of how we grade ourselves. But when you hit the U.S. News and World Report in the top tier, you stand back and just say, wow.
Being ranked as one of America's best is a sign that others are beginning to know something rather unique and exciting is happening here.
We've received numerous inquiries just since the publication from people who want to join our staff. They've heard about Children's Hospital at Montefiore. They've heard about all the wonderful things that are happening here.
The neonatal service has experienced tremendous growth. We have been fortunate to attract a large number of maternal fetal medicine specialists, which has allowed us to be able to care for many more high-risk women. And we have been able to really develop a collaborative group with our colleagues, all the pediatric subspecialties, and we work together in terms of planning out for the care of the baby.
We're proud to have a full-service children's hospital that looks after routine pediatric cases, but also the very high-end stuff. Liver transplantation, heart transplantation, kidney transplantation, stem cell.
We have a functionally integrated care system in transplantation for pediatric patients, which I think should be the standard of care at all institutions nowadays in order to get the best outcomes.
In my field of heart transplantation, that comprehensive multidisciplinary approach is not only important, it's absolutely necessary.
Pediatric bone marrow transplantation is a unique subspecialty. It requires very aggressive therapies, and it really benefits from the collaborative services of a team that's skilled in taking care of children with malignancies, but also with the resources of various subspecialties.
Sade presented here at 2 years of age. For the first few days, it wasn't clear what was wrong with her. She was losing her ability to walk and was taken to the operating room, noted to have a huge tumor in her posterior fossa of her brain with metastases going from the top of her cervical cord all the way down to her sacrum. To be honest, I've never seen so much tumor in a child. She had a debulking procedure and was noted to have medulloblastoma.
We can take a patient with a very difficult, challenging tumor and take them through the operating room, and that patient will have their motor function preserved because we've developed technology that will tell us moment to moment how well the nervous system is tolerating our surgeries. Most facilities that say they can monitor cannot monitor at a level that allows them to, in a reliable fashion, preserve motor function in their patients.
She was then treated here for the next year with very aggressive chemotherapy. It's really difficult to do this kind of high acuity medicine without a team. She was a really very sick child, but always had a tremendous amount of fire, very spunky kid. There are many, many people, myself included, who are actually pretty shocked at how well she's doing today.
I think there's tremendous support at the Children's Hospital that starts at the administrative level. It's a tremendous facility, beautiful rooms, state-of-the-art, technical support in terms of information systems, commitment to bringing people, support staff, nurses, social workers, child life. It's a tremendously supportive environment.
What we're doing is building teams across the entire spectrum of biomedical science. Our goal is to be a national leader in transforming child health. And to do that, we have to not only offer supreme clinical expertise, we also have to train the next generation of physicians and scientists, and we have to lead the discoveries that can help to transform the health of children. Innovative science plus cutting-edge technology plus supreme clinical expertise, all integrated in the context of a family-centered approach is what we aim for. And that's part of what makes this place a special place.